I want to share this other information with you because I was at the VA hospital in Brooklyn, 800 Poly Place, and I spoke to two intelligent, educated doctors, psychologists, and they're going to share their information with you, veteran population, of how they can offer their services to you and your family. So I want to present them to you, and believe it, you would be just as eager and excited as I am. So here they are.
Okay, well, thank you for inviting us here to talk about the work that we do here at the Veterans Hospital in Brooklyn. We're at the New York Harbor Healthcare System at the Brooklyn campus here out in Bay Ridge over by the Verrazano Bridge. And we'll just introduce ourselves. I'm Dr. Valerie Abel. I am the section chief of psychology here at the Brooklyn campus. And as well as that, I'm a geropsychologist and a neuropsychologist. So I have always, in the 15 years I've been here, worked in a lot of areas related to our older adult veterans in various medical settings and across different areas in the hospital.
Yeah. And I'm Dr. Jessica Jean Baptiste. I work in our palliative care clinic, oncology, and as well as our home-based primary care clinics. I've had the good fortune of also doing most of my psychology training at this very same VA hospital.
So we're very excited to represent what goes on here at the Brooklyn VA. So we thought we talked about what we wanted to talk about today, and I think we want to talk about a couple of areas that we work in, and primarily what we want to highlight and what we think is really unique about the VA setting as compared to the private sector outside of the VA is how integrated psychology and mental health services are into all areas of the hospital here. We call it integrated care, and the VA has really been a forerunner over a number of years of really thinking about how to bring both those aspects together into all forms of medical care here. And it's something that's kind of getting some traction in the private sector now with healthcare reform over the last number of years, but we really do think the VA's been the first ones doing it and really doing it really well. So we were going to talk about a couple of different areas. I was going to talk about our geriatric primary care clinic, and then Jessica's going to talk about the oncology and palliative care areas. So here in the VA, we have so for veterans who come here for their primary care and have a primary care doctor, every veteran who comes into our system is assigned a primary care team, a primary care doctor, but a primary care team. And what that means is that you're not just coming in and seeing your primary care doctor, but you have a whole team of people across disciplines that are responsible for your care. So on a primary care team, we call it a PACT here. It stands for Patient Aligned Care Team. We have a physician, a nurse, an LPN, often a social worker, a psychologist, often a pharmacist who's responsible for understanding your medication. Am I forgetting anybody else on the primary care team?
I don't think so.
Yeah, so basically so I'm talking specifically about my work on the geriatric primary care team. So the geriatric primary care team is a team that is developed with the specialists on that team to meet the specific needs of our older adult veterans. And just as we were getting started, we were talking about Vietnam, our Vietnam veteran cohort, which is a big, a large proportion of our older veterans. Actually, in the VA, the largest number of our veterans are older adult veterans. I think a lot of times when people think about the VA, they think about young young veterans who are coming back from deployments, and we certainly do service those veterans here too. But I think what's important for people to understand is that our biggest population are older veterans, veterans over the age of 65, and especially over the last few years as the Vietnam veteran cohort has been aging. We're all aging, but are in their late 60s and early 70s. We have an even bigger proportion of veterans with needs that are specific to our veteran population coming in and being older adults. So anyway, the primary care team, the geriatric primary care team, is a team that works specifically with older adult veterans who have more complex issues. So, and that could be complex medical issues. So some of our veterans who have multiple comorbid issues, like could be cardiovascular issues, could be more cancer issues, diabetes, mental health issues, substance use issues, other psychosocial issues, homelessness. There's a variety of issues that can make the care of some patients more complex. And so we see those patients in this primary care team. And the way we do it is, and we try to sort of make this is normal part of the way we deliver care, is our patients come in to see the doctor for their primary care appointment, and they first see a nurse who does various types of screening of mental health issues and other sorts of, checking of vital signs and things like that. They see the doctor, and very often we all sit very closely together in the same clinic area, and very often they're walked over to see the psychologist for any sorts of reasons that may come up in the primary care visit with the doctor, right? And I know that this is what happens in our oncology team also. So in addition, in geriatric primary care, some of the issues that come up with our older adults have to do with cognitive changes, right? So some veterans may come and see their primary care doctor and say, I'm a little concerned. I feel like I'm more forgetful. Right. Or the doctor may say, I'm not really sure why Mr. Z is not, we keep talking about how to manage his diabetes, but he doesn't seem to be able to manage it. And I'm not sure, is he having some cognitive problems? Or is he depressed? Maybe he just doesn't really care about doing this. Or are there other psychosocial issues? Is his living situation making it that he can't really do something more complex, like manage his diabetes? So the doctor will sort of bring the patient over and say, I'm seeing Mr. Z right now, and I'm not sure, he's having trouble managing his diabetes, and he said he's kind of down lately. And we do what we call a warm handoff. And I know that, when you talk about what you do in your care also, we really try to normalize this for the patient, right? We're all part of the same team. We're all here to address your medical, emotional issues related to how you're living. And I find that just having everybody presented in that way makes it very acceptable for veterans. Don't you find?
Yeah, and I think from my understanding with your clinic, because these veterans are sometimes presenting with multiple issues in different aspects of your lives, so not only do we meet with the patients, but all the team members that you mentioned before also have the opportunity to meet on a regular basis to sort of talk about the care about each veteran that we're seeing, to really make sure that everyone is on the same page.
That's right. So we have exactly right. So not only do we present ourselves as a team to the patient when they come in, and we all may be seeing the patient for different aspects of their care at that time when the veteran comes in, but we have a weekly meeting where we all meet and we review the cases of the patients that came in, and it gives us an opportunity to all provide our input and what are we doing, and helps us develop a treatment plan for that patient. We determined that this patient seems to be having some memory impairments. So we in psychology scheduled them to come back, and we're going to do some some cognitive assessment and get a better determination about whether there's something to be concerned about here, that maybe this veteran is developing dementia or something like that. I think, being in this co-located setting, again, meaning that we're all there together, means that not only do we have to wait until the end of the week when we have our team meeting, but we have the opportunity to just get up and stick our head into the physician's room and say, you know what, they actually now are, saying something about a swollen foot. Like, did you think, was there anything going on there, or is this something that maybe is more anxiety related for the patient? So we kind of do a lot of curbside consultation, we call it, so I think it's a very different way of working. I know in my experience getting medical care out in the community, I don't know if I've ever really come across that level of that kind of interdisciplinary integrated care. And I know that I have gotten a lot of feedback from our veterans, our patients, who say, it's really great that I really know that there's a team working here with me. I know all of you. I know I can come in and I can see if I have an appointment with this person. You really try to accommodate me and see me at the same time. So I think it really, really goes a long way in terms of us providing the best care for these patients, as well as accommodating them in this kind of more complex medical system.
And it sounds like there's so many benefits to having your co-located clinic with multiple providers. So even in saving the veteran one extra trip to the VA, right? Or the psychologist's ability to elicit the veteran's understanding of their medical care. The veteran can say, I just saw my primary care doctor, here's what they think is going on, and we can sort of help to see, does the patient understand what's happening? How can we help them with next steps? What are additional questions that they may have for their provider?
Right, absolutely. And I think, we also end up trying to think of various ways to, where our geriatric primary care clinic meets is in a larger kind of clinic area down in our other part of our building over here. And so a lot of our older adult veterans, come there to see their doctor. And if there is a need for them to follow with mental health, with any sort of mental health care, a lot of times veterans and patients of all ages could feel some stigma related to, I don't need to see a psychologist, there's nothing wrong, there's nothing wrong with me. And here, because we make it all it's part of the care that we offer, and we do it in that same location, it really allows veterans to feel like they get their care in their home area. And we provide a lot of other groups and other types of services there, memory training groups, healthy aging groups, things like that in our clinic area there, because that's where these veterans are used to coming, and it feels like a home to them. So
do you find that the various psychological services that are offered are highly utilized by the patients coming in?
Absolutely. So it's really kind of a more creative way of thinking about how to offer these services. So why don't we switch over to your area that you want to talk about, because this integrated care model applies very much as well in the areas that you work in.
Yeah, I think a lot of what you're saying is very similar to the oncology clinic. So where we are seeing veterans who have been diagnosed with a cancer. And there, just like in the geriatric primary care clinic, we have a large multidisciplinary team. Our team now has 3 oncologists. We have a radiation oncologist, a palliative care team, a nurse, psychologist, a social worker on our team, and now we've had chaplains also who work closely with psychology. And really the hope for having psychology as part of the team is to destigmatize mental health care, right? Help veterans be exposed to what is available to them early on in their process, Also, our hope is also to help veterans navigate the system, as it can get pretty complicated.
Absolutely.
Going through your cancer treatment journey, being first diagnosed, now making decisions about your treatment,
Right.
going through your treatment process. Our hope is to really work alongside veterans during this journey. So the way our clinic works is a veteran comes in for the first time. The first day they come in, they go through what's called a triaging process. So the triage process involves the nursing staff doing regular vital checks, and we have the nursing individual assess the patient with a templated distress screen. So that way, again, it's part of their routine care. We're asking about psychological distress as they're coming into the system. And that same day, they'll see their oncologist, and before they leave, they meet with one of us on the psychology team. And that's really a meeting to introduce the patient about what services are available to them, maybe even get a snapshot of what they've heard from the doctor, how are they coping, or there are ways that psychology can continue to be helpful. And the hope, again, is to have veterans be aware that if you are going on this process, we are there along with you. And psychology is involved on multiple ends. So if a patient is already receiving chemotherapy treatment, for instance, and are having various issues, anything from transportation, being able to get there, or managing the symptoms that come with chemotherapy, managing the length of treatment, making decisions on should I continue, is it time to stop, when do I talk to my family or my doctors. So we also try to be part of that process and to be with our veterans during those times.
I'm just thinking, one of the reasons that we started doing this in our oncology cancer care program was related to some research that you had done a number of years ago that really looked at the kind of barriers that patients have in terms of accessing mental health services when they are diagnosed with cancer. And what I remember you seeing was that patients very often, when they're in a cancer program, they've been diagnosed with cancer, they're not very likely to reach out and say that they need some sort of mental health support. And what you found was that by setting up a psychologist to be available to meet as part of the incoming triage process, when somebody first comes into an oncology setting, to have them meet the psychologist, have it be introduced to them as, this is part of your medical team, we take your mental health and your distress very, very seriously and want to support you with that veterans and patients were much, much more likely to and much more accepting of asking for that help further, as their cancer process continued. So we felt it was really important. That was a really great way of sort of thinking about how do you meet the needs, and what can you offer to veterans to allow them to feel like this is something that they deserve,
Right.
and that we can offer to them, right?
And the study looked at specifically at utilization of mental health services amongst veterans diagnosed with cancer. And we also looked at when is the right time to actually ask veterans about whether or not they would like support in their treatment journey. And exactly what you said, the study found that it is most useful to ask people at the very beginning.
Right.
Whether or not they start psychological services wasn't really as important as them knowing that this is a routine part of your medical care, something you deserve and something that is being given to you. The other thing that we found was that, this is just anecdotally, veterans coming to me and saying, I don't know what I would have done if I walked out of this building after receiving this diagnosis and no one said anything to me. Right. One veteran said, I was actually planning on just walking around in the parking lot until I figure it out, because there's no one to talk to about this. Right. And so knowing that, these are pretty serious conditions that people are facing, and just having that conversation and saying, we are here for you, here's what's available, was enough to reduce the distress for a lot of folks. And what we found was that if we do encounter the same veterans later on, so for instance, they're in the hospital for any reason, and a doctor asks a psychologist to see them, we can start off the conversation by saying, hi, we've met you before, we're just here to see how we can support you. And so it becomes, again, a routine part of your care, something you can expect to happen.
Right. I mean, I think there's a lot of, some veterans will tell us, that day that you get a diagnosis, right, and you hear the words cancer, you sort of freeze, you kind of, people will say, look, I didn't hear anything after that, right? It's a very, very shocking word to hear, right? And people will say, look, I kind of went on automatic pilot. They don't really know what to do with themselves. So people, and sometimes it can take a while for somebody to be able to kind of come back and sit down and say, okay, these are the decisions I have to make. Right. What sort of help do I need making those decisions? So I think just being able to educate people that this is normal, this is a normal response, right? Yeah. We know that people can feel really overwhelmed at the beginning. It's okay. Let's think about who you want to bring with you, How can we help you? Talk and ask questions to your doctor the next time you come. I think there's a lot of ways of providing education just at the beginning with veterans that just, allows them to feel like, I'm not the first person going through this, right. And there's help here, along the way. So, so kind of a similar way of just normalizing and bringing psychology onto the team, right? Do you want to say anything about palliative care?
Sure. So palliative care is also a service that is offered to veterans, usually not in the beginning of their diagnosis stage, but at some point we might offer that service, and it's really, the hope is that it's in addition to whatever care they are already getting. The palliative care team also has a nurse practitioner, a physician, myself, the psychologist, and a social worker. And the hope of the palliative care team is really to focus mostly on that veteran's quality of life. So what is it that you want in your medical care? How do you see your medical care long term? And what are some services that we can offer to help support your goals? And the palliative care team, again, works pretty closely with our oncology team. We work closely with the geriatric primary care team, and also follow the veteran along in their journey. We often are seeing patients when they are sicker, but it's not necessarily, it doesn't have to be that way, but we do see patients who are sicker or in the hospital. And also...
Right. Well, it's what I think is really, and I talk about this a lot with my friends outside of the VA system, when they're talking about aging parents in the medical system outside of the VA. And, here in the VA, there is such a great emphasis and such support for bringing palliative care in at an earlier stage of treatment, really with the idea that, it's not hospice care. It doesn't mean that we're expecting somebody to die in the very near future, but it's shifting the focus around what's important to you. Instead of just focusing on the this is what we can offer you medically, this is how we're aggressively going to treat you. It's really helping the patient and the family decide what's important to them. How do you want to go through this process? How can we support you and help communicate with the other medical teams that are involved in a way that, again, really understands you as a whole person in this process, right? And I find, that I just don't hear about that as much. I'm putting in a little plug for the VA here, but I have to say, being someone who's not a veteran, and talks with a lot of people outside of the VA, I do think this is a real strength in the VA system.
You are absolutely right, because even we've actually advocated for the policy for palliative care patients who are on a hospice team, if you are a veteran, it does not stop you from still pursuing curative care.
Right.
So you can continue to receive all the care that you want to have and still be on hospice and still have palliative care services if you are a veteran.
Right.
So the hope is that we are just providing you with more support.
Right, exactly. So in tying up, I don't know, I think we just, I know we work very closely together, and I know we just so appreciate working here because of these kinds of different ways of working that are really supported here in the VA. And I think we both really feel very strongly about and are always so impressed by the resilience and what our veterans, the veterans that we work with, bring here to us. I think we're really lucky clinicians to be able to work with our veteran population, and we both do focus a lot on our older adult veteran population. And I feel like I learn something from them, from somebody every day, that they have just as much to teach us as we have to offer them. So and even more. Right?
I mean, I think it's an absolute honor to work in a system where you have all of these available resources, and I can work alongside different professionals to provide care to veterans. And again, being able to work with people at all stages of life really has been
it's very rewarding.
A true honor.
It's very rewarding. Yeah. Thank you to our veterans. Thank you.